30 seconds out, actually. I don't see Tom and Brent yet, but maybe they're dropping in.
Hey, everybody. Hi, Greg. Long time no see.
Hi, Ann. I know, we were meeting this morning. Hi, Linda, Jeannie, Karen,
Hi.
Charlie. I see Lindsay and Kara's on, John Ely's on. All of you who are not showing your faces, I've got to read this fine print. Brent's connecting. Okay, so we're almost there. I think Tom may be the only one we're waiting for. Are you in for Tori today, Ann?
I will be. I expect him to be in the meeting.
Okay, we'll
But we
see.
can always start with me if he's a little late.
We'll give him another minute, or roughly. Hey, Brent. There he is. There's Tori. Mayor's coming on. Excellent. I think we should get started. It's 1:31. This is the Pitkin County Board of Health meeting. I'm calling the meeting to order now at 1:31 p.m. It looks like we have everyone here, but I want to get a roll call for Lindsay. So if I can start, Tori is here. Brent.
Yep.
Marky is not with us today. Tom, if you're there, somebody will have to make some noise. I can't see everyone. Not here yet. Jeannie and Linda are here, right?
Yes.
See you there.
Yes.
You can hear us? Thank you. Okay. Let me get back to my agenda. Will that suffice for a roll call, Lindsay? If she's here.
Yes, we're at quorum.
Okay, we've got quorum ready to go. Okay, reviewing the agenda, maybe I should let Karen do that. I know there have been a couple changes.
Sure, thank you. Lindsay, would you mind bringing up the agenda as well?
No.
Okay. So as far as the agenda, if you can just go back right down to the next page. Thank you. We had originally a section on protect our neighbor from 2:10 to 3 o'clock. And because we're not in a position yet to apply for protect our neighbor, felt like we could put this off this conversation for the next Board of Health meeting to talk about the metrics and the different aspects to meeting that requirement. And knowing that we always have a really packed agenda, I thought that that would be an easy place to shore up and reduce some of the sections so that we can get to more places for discussion and the round robin at the end. So we'd like to take that part out. So, and then that probably, I think that it actually might be the only adjustment at this point, Greg, to the agenda.
Had you mentioned, was that the only one? Was there one other thing? Oh, just the March 8th to July 8th. Do you want to keep that in if we have time?
You know, why don't we, we'll see how the timing goes. And if we need to reduce something else, we can take that part out. So maybe we can play that one by ear a little bit.
Got it. Okay. Yeah, we're trying to free up enough time so the board can actually have a discussion. I'd love to get a motion to approve this agenda in a second. I can't see who's there, who's not, but I'll need somebody to make a motion, I think.
I'll make a motion to approve the agenda.
Okay, Jeannie moves and
Seconded by Tori.
Tori seconds. Okay, all in favor? Let's say aye. Okay, thank you. All right, Lindsay, if you got that, we're going to keep going with any corrections or approval of previous minutes. Anybody have anything to add or comment on that? Okay, Tom's joined us. Hi, Tom. Glad you're here. So I think we've got our quorum already, but we're glad you're here. I'd like to get a motion to approve the minutes. Tom moves to approve minutes. Brent seconds. I'm just doing this visually. I can see you guys all in favor. Aye. Okay. All right. I see it. We've got it. We're going to keep moving here. Okay. If we're ready, we're going to move right into the introduction and data presentation. Thanks, Karen.
Great, thank you. Everybody Greg, can you hear me okay, actually? Is it? Okay, thanks. All right, so Lindsay, if you wouldn't mind pulling up the slide deck again.
And by the way, if anyone has a question, we can't always see you, so just speak up. It's okay. I don't think we'll be interrupting each other too often.
Great. Okay, thank you. So I wanted to frame up sort of where we are to date in the global pandemic response. And I think once we go through the data, it'll be a really good grounding in using data and science to make decision making as we move forward as a community. So as we know, I think really we're at this critical place in our community where all of us have to stay committed to staying together and doing really the same things we have been doing that hopefully will allow us to get to a place where we have enough of a reduction of the viral transmission that we can do more. And then I think we also have to philosophically accept that we're going to absolutely see more cases until the time that we have pharmaceutical interventions for this virus. And so we're in this really strange place right now because until we really have that ability to protect the population from the virus completely, we have to find a balance between preventing people from getting sick in large numbers and then still having some semblance of a life and community. And we know that transmission increases because people need to have social connections and they want to have social connections, and we want to have the ability to travel, and all of these things are going to impact the ability for us to keep the virus in check. So it's very human to want to connect with people and to be around people we care about, and so how do we sort of maintain this fine balance of being able to be humans and doing things that are valuable to us, and then also ensuring that we have, keeping our social bubbles small and ensuring that we have social distancing at 65%, reducing our activities so that we aren't interacting with as many places or people. We know that mobility patterns in our community, when we were at really at its true suppression stage, Pickens County was one of the most successful counties in the country around reducing mobility, and we kept getting an A+ rating. And unfortunately, we're kind of down to a D- rating at this point. So I think we just need to all be able to continue it's going to take all of us to really continue to do individual efforts as well as community efforts to be successful. And that includes things like being able to find and continue to find people for contact tracing and having folks participate in that program, and for all sectors of our community to be engaged in their responsibility to protect our community. So really, until we have the goals met of an effective vaccine distributed through the community, and slowing the transmission of SARS-CoV-2, protecting the healthcare system from surge, protecting the most vulnerable to severe illness. And then really another goal that we've been really thinking about is how do we have a community in which kids can be educated in the fall with a scenario for the best learning environment for them, knowing that community transmission of disease will really impact the sort of the choices that we have around schools, being able to educate kids, particularly in person. So I just want to preface that with this first slide, and then Lindsay, if you can get to the advance to the next one. And so what we know is that we have tools in our toolbox. And these are really, until we have pharmaceutical interventions, these are the tools that we have in our toolbox. Maybe new ones will emerge, but some of these are based in tried and true public health principles and practices. And a lot of it's based in messaging and how we communicate with the community and how the community is receptive to behavior change. We've asked a lot of people to change their behaviors in a very short amount of time. When we think about, 4 months, where we've asked people to really drastically change, how they go about doing business, how they interact with people they care about. And it is pretty phenomenal in that respect, that it's hard. It's really hard to change behavior in general, and it's really hard to change behavior quickly and in such a drastic way. And so when we think about this response overall, these tools are what we have right now to be able to be successful. And I've put this out before as containment tools and then mitigation and suppression tools. So we continue to have the Box It In strategy as a tried and true public health strategy for disease containment. We have the employee and consumer protection programs that are also, you think about retail food, this is very similar to that. So, based in public health principles, those are still being built out by both the city and the county. We have sector guidance plans for almost every sector now, and been working really closely with those sectors to get those in place and to have all the fine detail that really helps sectors to be successful in their disease containment. Then we have the messaging that we've been promoting for a long time, which are, the 5 commitments that you're all aware of, which includes mask wearing, and then the avoidance of the 3 C's. And that is really a critical message right now, especially I think once you hear from both Josh and Charlie in regard to what we're seeing, the changes in the virus right now and the scientific changes. Then we have the public health orders, which is more of a heavy-handed mitigation suppression approach. But finally, I think the most important part to me right now is all of those things are based in science and based in data, and using data to inform how we go about if we're in containment, or if we're in mitigation, or in suppression. We're using data to determine that, and that's sort of our guideposts and our roadmaps to figuring out what we should be doing, where we should be in sort of that suppression or containment mitigation suppression phase.
Karen,
Yeah.
could just for people who may be watching,
Sure.
could you articulate the 3 C's, the avoid the 3 C's for
Sure.
us?
Yeah. They are closed spaces with poor ventilation. And again, you're going to hear a little bit why the ventilation is so critical in the data presentation. Crowded places and with many people nearby. So we want to avoid crowded places with a lot of people. We want to avoid closed spaces with really poor ventilation. And we want to avoid close contact with people. So like close range conversations. So even though you're wearing a mask, doesn't mean you should be right next to somebody talking with them. And this, as I mentioned, we'll talk a little bit more about the disease and SARS-CoV-2 and what we're learning about it. But this avoidance of the 3 C's is actually really good, a really good strategy to address super spreaders as well as places where outbreaks might happen. So this messaging will become even more important as we move forward in our messaging to the community in the next few weeks. Does that help, Greg?
Great, thank you.
Yeah. And so finally, I think this is my if we can move to the next slide, Lindsay. So this is my call to action for the community. We're really at an all hands on deck stage right now. We're at a critical point in our community with the data that we're seeing. And honestly, we cannot reach those goals that I mentioned, nor can we reach the containment ability to contain the virus if we don't have every single person in our community participating in the reduction of the spread of the virus. And that includes all the individual choices we make, as well as the role of private, nonprofit, and government agencies. We all have to play our roles. It can't just be one agency or one person or one business that does it. Everybody has to see their role and responsibility in this. Because if that means that the community needs to understand how to better follow the public health order, or they need more encouragement to maintain the 5 commitments, or participating in the disease investigation box it in strategy, we're seeing more and more people with COVID-19 illness in our community, and you'll again learn more about that in the data presentation. And we've really been focused on containment strategies, but if those containment strategies aren't effective, we are working on the public health and medical advisory team. We're finishing up a trigger document, and what that will really do is it will get us back into tightening up in our community and increase the need for mitigation, or it will actually increase mitigation in our community. And that document will be focused, the approach of that document will be, we can have a very focused approach, so we can look at tightening up the public health order in relation to based on contact tracing trends and outbreak data. And we could focus specifically on a sector or like a business if it's having trouble. So it'd be very targeted, very scalpel-like in our approach. We can also look at like the more generalized approach. So we might have to say, right now we allow for 50 people in a group size. We might have to step that down to 25 if that's where we're seeing a lot of outbreaks or a lot of transmission happening in people gathering together in informal gatherings. So that's another approach we can have. And then if we're really having trouble managing the sort of the uptick in data, then we can have more of an inclusive approach where we would be looking at, going back to some of the major changes that we made in the safer at home order, in which we would be looking at sector closures, right? So that might mean that one sector might go down to 25% capacity or something like that. And we're planning on bringing this document to the Board of Health in the next board meeting. And we're going to continue to look at the data to continue to see where we're seeing transmission events happen and adapt if we need to and put in additional measures. And I think if we have any reason that we need to tighten up before then, we'll call for an emergency Board of Health meeting, because that's where we are right now as a community. So I guess just my plea to everyone to really think about your individual and all of the ways that we can all play a role in reducing the transmission of SARS-CoV-2 in our community, and in essence allowing people to not, we don't want our friends and family to get sick, and we're again seeing a lot more illness right now. And so with that, I'll turn it over to, I don't think we've formally introduced Josh in the past, so we have a new epidemiologist on staff as well. So Charlie and Josh are gonna give the presentation today. Dr. Levin is on vacation.
Great, welcome Josh, and take it away, Charlie.
So Lindsay, you can leave these slides up and just advance to the next one. One more. So as usual, I want to start with a kind of a public health moment here. In 1842, Sir Edwin Chadwick observed that life expectancy was much lower in cities and towns than in the countryside. Kind of one of the reasons we live in an area like Pitkin County. And after studying this problem, he published a report into the sanitary conditions of the laboring population of Great Britain. And he became a proponent of sanitary ideas, as well as a miasmatist who believed that disease was caused by breathing foul vapors. Since sewage and garbage smelled bad, it must be associated with disease, and therefore the solution was to clean up the environment. And he concluded that what they really needed were more engineers rather than more physicians to devise more efficient ways to deliver clean water, remove sewage, and other noxious substances. So as you might expect, this movement resulted in remarkable improvements in health and well-being. But another outcome of this was landmark legislation to create a General Board of Health in 1848 in London. This was your predecessors, which was created over 170 years ago. And I bring this up because, like Sir Edwin Chadwick, public health boards have a duty to establish programs to protect their citizens. And sometimes you need to protect them from themselves. Those programs, a lot of those programs, especially preventative ones, can meet with resistance because sometimes if you tell people to wear masks and cases go down and cases don't happen, they may come back and say, see, we didn't need to wear masks. So if nothing happens, you don't get that feedback. But that's our role and we have to accept it. I also wanted to present just a little bit of data that comes not from public health, but from Goldman Sachs. Go ahead to the next slide. It's a little bit fuzzy, but their data showed that countries that have failed to reach widespread mask usage are seeing both infections and deaths increase. And their research showed that a nationwide mandate to wear masks could mean a 5% improvement in GDP. So extrapolating that to our local situation, wearing masks can help us improve our economic situation. And I know saying that we need to promote face coverings at this meeting is like preaching to the choir. But right now, I want to stress again that there is no more important messages than the 5 commitments and getting people to cooperate with contact tracing for both our personal and our economic health. Next slide. And then I want to put into context our data before we get to that with what's happening around us. Cases are rising across the US in the majority of states. 7 states are reporting new highs for current hospitalizations, and the US reported more than 800 deaths on Tuesday and yesterday, and it was the first time fatalities have increased since June 7th. So in the US as a whole, cases, hospitalizations, and deaths are increasing in all of our surrounding states. Next slide. And states like Arizona, California, Texas, and Florida are driving this increase in our nationwide statistics. In all, 33 states and US territories have rolling average new hot cases higher than last week. And we haven't seen the impact of July 4th gatherings yet. Positivity rates for testings have climbed to over 10% in many of those states, and most are going to be forced back to stronger suppression strategies. Some have already taken those steps. Our goal, as Karen said, remains to avoid this crush of cases and to protect our residents, visitors, healthcare system, and our businesses and economy. And the way to do that is to stay the course right now, not to keep increasing group size and other aspects. Next slide. Now we're going to zoom a little bit down to our state level. 2 weeks ago, Colorado reported 31,155 cases and over 1,600 deaths. Today, they reported about 4,000 more cases and about 40 more deaths. 2 weeks ago, there were 135 patients hospitalized for COVID-19 in Colorado. Yesterday, there were 151. So Colorado's faring better than our surrounding states, which is great news. But cases, hospitalizations, and deaths are starting an upward trend here in our state. So now we're going to take a look, go down another level, and I'm going to look at hospital data and then turn it over to Josh, who's going to look at our epi data. So this chart shows community testing requests. And if you remember, community testing is done when patients go to their primary care physician and ask to be tested, and they're referred to ABH for testing. Some of the choppiness you see is that because they haven't done testing on Sunday until really recently, when the demand increases, they started increasing hours. But the best measure to look at on this graph is the trend line, which is increasing, the dotted line that's going up and to the right. Since April 24th, ABH has completed 455 community tests with a 6% positivity. And you can see that this level of community testing demand has exceeded ABH's comfortable level for the past 2 weeks. So that's a concern. Next slide. So the next category of testing is respiratory testing in the Respiratory Evaluation Center. Used to be called the tent, but they've now moved it inside. And these are patients that are coming to the hospital to be evaluated for a respiratory type illness, but they don't want to take them into the ER, so they do take them into this clinic. The trend line for this group is also increasing with a comfortable level at 10 a day, and that was exceeded for the first time last week in the last week of June. And I show you these charts because community and respiratory clinic testing demand is a measure of kind of syndromic surveillance, and that trend is rising. In other words, we're seeing a lot more COVID cases. Next slide. So we looked at the previous test, two graphs showed PCR testing levels in the respiratory clinic and community testing. This chart shows trends for the visits to the emergency department. So we've looked at people that were referred by physicians. We looked at people that came directly to the hospital with symptoms. Now these are people that have more severe symptoms and have to actually go to the emergency department. And you can see that the most recent trend is rising again toward March levels, after quieter levels kind of in that mid-April through May, when suppression strategies were most effective. Next slide. The good news is while testing and ED visits are trending up, hospitalizations have remained low. Our concern is that hospitalizations lag the increase in cases, and we're watching this closely. We did have one patient admitted and transferred to a higher level of care last weekend, and currently there's one patient at ABH in the ICU. So we're starting to see a little bit of activity there. A question that was recently raised about transfers and this data, I just wanted to clarify that there have been a total of 7 transfers since March, and 6 have been discharged, and only the most recent transfer remains hospitalized in Denver. And there have been no deaths in that group. So next slide. And finally, there is an uptick toward the trend line in ABH employees with COVID-19 like illness out sick and or on quarantine and therefore not available to work. But just touching the threshold, it's just moving up to that level to be cautious. And we're gonna have to be watching this data as well. And I also wanted to give you a report that ABH has used the A2 antibody test to test 464 of its employees, including first responders. They found 14 positive antibody tests, 450 negative. So a prevalence of 3% of that at-risk population. So you might extrapolate that and say, you know, if we did this out in the community, you know, would we find an even lower rate, or at least nothing much higher than that? Next slide. So wrapping this all up from the ABH's point of view, trends in respiratory and community testing, ED visits, and essential healthcare workers not available to work have kind of alerted ABH that they're moving into a more cautious stage for these measures. And in other words, we're seeing an increasing number of individuals with COVID-like illness coming to and being referred to ABH for evaluation, medical care, and testing. And this will have a bearing on capacity, as well as testing supplies, PPE, and staffing going forward. These are things that we haven't had to worry about for a couple months, you know, not since March, but they're starting to get back on our radar to be thinking about. We are fortunate that our other important measure of hospitalized COVID-19 patients remains comfortable in terms of capacity at the hospital. So now I'm going to turn it over to Josh, who's going to talk to you about the epidemiologic data here in our county.
Well, good afternoon, everyone. As Karen and Charlie both said, I'm Josh Vance. I'm one of the new epidemiologists here on staff. And Lindsay, if you can advance to the next slide, please. So I want to discuss more of the data that we're seeing here in Pickens County, not just at the hospital, but what we're seeing throughout the entire county. This graph here, this is called an epidemic curve. And most of you have probably seen this before, but it shows our cases that have been reported in Pickens County residents since the beginning of the pandemic. And what you'll notice is that back in March, we had that pretty large peak there. In early April, we had that pretty large peak right there. And then we kind of petered off and didn't have as many cases. And now we're really starting to see an increase in cases again. I meant to include today's data as well, but if you look yesterday on the 8th, we had 7 cases reported in Pickens County residents. That doesn't include all the cases that are travel associated, so people that might be traveling from Florida or Texas or Arizona, any of the states that Charlie discussed. That doesn't include those, and we follow up with many of those as well. And it doesn't include all the individuals that we contact. That's just simply 7 cases that were confirmed positive in Pickens County residents. Today, we already have 5 that have been confirmed as well. So in the last 2 days, we've had 12 cases. Next slide. This here, this shows our most recent cases from June 1st to yesterday. And this shows where these people were exposed. So you'll notice that about 28% of those who have been exposed recently were community spread. Community spread means that we don't know how they got sick and they don't know how they got sick. All they know is that they have a positive result. And when we followed up with them, they were not able to provide us any information on who they think they were exposed to. And that's always concerning when we see high levels of individuals with unknown exposure, because it indicates to us that, they're being exposed, pretty innocuously. They're not really sure where they're getting sick from. So it's always a concern. About 24% of our cases were travel associated. So that means that they were exposed. It's a Pickens County resident that was exposed to somebody who had recently traveled. The same percentage of individuals were exposed at a workplace in, not necessarily in Pickens County, but in Pickens County residents. About 20% were exposed in the household or to a friend. And then we have a very smaller percent of individuals that have been exposed in a healthcare setting or at a party. That doesn't include recent 4th of July data, and we expect that might change once we get that data coming in. Next slide, please. And this is some data that we've been working on recently. This is individuals who have tested positive, Pickens County residents have tested positive, and what their underlying conditions were. So you'll notice that we have a sample of 68. We didn't have data on all of our cases, so we used the data that we had. We used the cases that we had data on. And so we took some of the most prevalent conditions and we mapped them out to see what percent of individuals that were COVID positive had these conditions. And so I compared these with estimated prevalence in individuals across the US or across Colorado, just to kind of give you an idea of, are we really seeing more individuals who are overweight or obese or have type 2 diabetes diagnosed with COVID, or is it really comparable to what we expect to see in the general population? So when we look at the first category, we have 37% of individuals that had a BMI above 25. And that's pretty on average with what we see across the region. So there's not a very significant difference there. When we look at diabetes, same idea, it's pretty comparable. So we've been told for a while that, individuals that have type 2 diabetes or hyperglycemia might be more at risk for COVID. We're not necessarily seeing that. It's not that it's not a risk factor, but what we're seeing is that the individuals here in Pickens that have type 2 diabetes, it's about on par with what we expect to see across the nation. Individuals with heart-related conditions are about double what we expect to see in the population. So we are seeing people that are diagnosed with COVID, they do tend to have heart-related conditions at about twice that of what we'd expect. And again, this is a small sample, so we have to be careful with really looking at the data too closely, but we are seeing that there is a difference there between those two groups. Thyroid disease is about 4 times higher than what we expect to see in the, across the country. Thyroid disease, a lot of individuals with Hashimoto's or Graves', they're immunocompromised, and we know that immunocompromising conditions may lead to, are a risk factor for COVID. So not necessarily surprising, but it is more than we would expect to see. Sleep apnea, again, that one's pretty close to average. And then high cholesterol is pretty close, but a little bit higher than what we're seeing in the US. So the reason why I show this data is to show that, while we have a lot of different underlying conditions that we've been looking at and that we've been told are risk factors, we really wanted to look at, what are our data showing us and what are the risk factors for individuals living in this area. And right now it seems heart-related, thyroid, and high cholesterol may be the main factors right now. Not to say that the other ones aren't factors, but those are the three that we're seeing most prominently at this point. Next slide. So now talking about this strain that we're beginning to see predominate, and it has been predominating for a while, but their research has really lagged what we've been seeing. So you'll notice in the orange, that was the D614 strain of COVID. That's the one that began in Wuhan and really predominated in Asia or through China and Eastern Asia. In about, I'd say late February, early March, we began to see this new strain, G614, really take over. And over the next few months, it's really predominated and become one of the only strains that we've been seeing throughout the world, really. But if we look back to March and April, we were being pretty good about distancing, wearing our masks, washing our hands. And so we weren't necessarily seeing a large increase in cases. But now that we're becoming more lenient and individuals are becoming more complacent with those mandates and with those asks, we're starting to see this become more of an issue, which I'll explain on the next slide. So this new strain, G614, it's mutated to develop a spike on the virus. And researchers think that this spike actually enables the virus to almost inject itself into our cells much more easily than the previous strain. The previous strain also had a spike, but when it tried to get into our cells, the spike would break off. And so it was far less able to infect our cells. This one with this spike can much more easily get into our respiratory tract. And what researchers are finding is that because of this spike on the virus, it could be up to 10 times more infectious than that D strain. So while this strain has likely been predominating in Colorado since late March or early April, we're beginning to see the effects of this virus or this new strain a lot more recently because of the fact that we have become more loose with our distancing strategies. The good news about this strain is that researchers have found that the fatality rate is about the same as the other strain. So we're not expecting to see a larger percentage of fatalities. However, if we're seeing more cases, that means we're going to see more deaths. It's going to follow and it's going to track. So it's concerning to see this research come out and to see the infectivity of this virus and just knowing the ways in which it's able to infect others. And I'm going to touch on this a little bit more on the next slide. So this new, even newer research has been coming out, and this has been a question all along: is COVID airborne? And a lot of researchers for a while have been saying yes, it is airborne. A lot of them have been saying the opposite: no, it's not. There's a lot of consensus now that it is airborne. And what this means is that what we've known about respiratory viruses for a while is that they spread via droplet. So when someone coughs or sneezes, it travels about 6 feet or so, and then it falls to the ground. With it being airborne, what that means is that when we sneeze, cough, talk, the particles can actually linger in the air for minutes to hours, and it can just sit there. And so if somebody walks by, minutes or hours later, it's possible that the virus is lingering in the air. And so that's obviously concerning because that brings into question a lot of our practices. Well, if we're distancing 6 feet, does it really make a difference anymore if it's airborne and the virus is lingering in the air? More concerning is this study, which I'll read here on the left-hand side of the screen. it showed that newly released aerosols, which are about the size of a human hair's width, produced from coughing or sneezing of infected people, have the potential of containing many viruses, particularly for carriers who do not show any symptoms. And so that piece is concerning because, you know, for a while we've looked at individuals who are asymptomatic as maybe not being that infectious. This study was finding that individuals who are asymptomatic, they may actually be able to produce more of these aerosol or virus-containing aerosols than individuals who have symptoms. Obviously, more research is being done on that, but that's what this study found, and it's concerning. And so what they concluded is that wearing of face masks in public corresponds to the most effective means to prevent interhuman transmission. And so they really touted the importance of wearing masks in all places, not just when we're in certain indoor arenas, but they're saying masks are important no matter where we are. Over on the right-hand side, this article stated that mounting evidence is suggesting that because the coronavirus is airborne, we really need to ensure that our health advice is matching what the research is showing. And right now it's not catching up. This graphic on the bottom shows maybe some of you have seen this, but this was a research study done in China. The individual in the yellow there, they were infected. And because of the air conditioning that was moving through the restaurant there, that person was able to infect individuals across the restaurant. And the dates there are showing when those individuals developed symptoms. And so they were finding that the virus is traveling on the traveling through the air conditioning and actually infecting other people that were much further away than 6 feet. Next slide. And so I think we're not gonna touch on this. Is that right, Karen? We're gonna move past this for today.
I think you can just allude to, these are the data points that we have been tracking and will continue to track for Protect Our Neighbor in order to meet that next phase of opening. But maybe you can just page down a little bit, Josh, where it shows metric 4.
Yep.
Oh, maybe.
Put it on the last slide.
Oh, okay. Yeah.
The
So
next
I guess that's just the key point right now is for you all to be aware of that right now we wouldn't qualify for Protect Our Neighbor because we don't meet metric 4. And again, we'll talk more in detail about all the components of Protect Our Neighbor in the next board meeting.
But really metric 4 is looking at how many cases are we seeing in our community. We're seeing very high rates of the disease. So the next slide actually shows our 14-day average. And so what this does, it takes all of our cases over the previous 14 days and we average it out and then we divide it over our population. And Protect Our Neighbor wants us to be below the green, and we'll talk about that in the next meeting. But you can see that we're very, we're at the highest point that we've been at since the beginning of the pandemic. We're seeing about 23 cases in the last 14 days. And that means that our rate is 130 for every 100,000 individuals. So it's very high. That's obviously concerning because when we get to levels that high, it becomes hard first of all, it becomes hard for us at the health department and, in contact tracing to really, get a hold of everyone in a timely manner. But secondly, it indicates that we have significant spread of the disease. Especially in a small county as Pitkin, we expect that those levels, should be a lot lower. And when we look back to May and June, you'll notice that our levels were very low. But we've seen a dramatic increase recently, and we're expecting that this will probably continue to go up once we start to get our data from the 4th of July in. So I think that's all the slides I have. I'm not sure who I'm passing it off to.
Great. Thanks, Josh. Greg here. Just want to get us back. Karen, we are at, let's see, we're at 2:13. I think that we're running behind by about 15 minutes or so. Do you want to hold back on the March 8th, July 8th, save that one, or where do you want to go from here?
Yeah, let's save that because I really want the Board of Health members to be able to ask any data questions that they have. I think this is really important information. So, yeah.
So do you want to, is this the smaller sacrifices for bigger gain discussion? We're keeping that, and I'll let you take it from there.
And I guess, yeah, so if people, if folks do have questions for Josh or Charlie before we move on, I think this is a good opportunity
Okay.
to
Oh,
ask.
got it.
Yeah.
Sure. And I will look for anybody have a hand up. I don't see anything so far.
Said one.
Sorry, who's that? Brent? Okay, Brent, go ahead. And then Jeannie.
Yeah, I mean, I've got a few questions, but one question, Charlie mentioned that, of course, most of the people that are seriously ill get transported out. Who makes that decision? Can the patient make that decision, Charlie, and say, hey, I've got COVID, let me out of here? Or, you know, do you have to wait for some physician to say, yeah, you've got COVID, and what? You need to be sicker before we get you out? Because everything that I read says the quicker you get diagnosed and the quicker they get oxygen early intervention now with oxygen and a few of these things, and especially if they can get remdesivir, which I understand does not exist in the Valley. What is your belief on that?
I think the physicians at ABH are making that determination, but they, you know, part of the reason to transfer people is to get them to a lower elevation, which
Right.
makes it much easier to manage a respiratory disease. Second is that St. Mary's and Denver have higher level of care and may have drugs that aren't available here or other methods. So and it also protects kind of the capacity of the hospital. You know, we only have 4 ICU beds. So if we have somebody and we have the ability to transfer them, ABH should make that determination and get them to a higher level of care.
Is St. Mary's preferred over Swedish, or is that the same?
No, I think that they're talking on a daily, weekly basis to determine who's got the capacity to receive the patient.
Right, thank you.
Great.
Just to add
Jeannie,
to that,
question?
Greg,
Oh,
if I
sorry.
could just add, sorry. This is Suzu. I just wanted to add a little bit to Charlie's response to Brett's question, if that's okay, before we move on.
Sure.
Sorry.
Suzuho, go ahead.
Yeah, and so part of the decision around that that ABH is making actually is not necessarily related to COVID. So even before we get test results back, people may be transferred. So ABH is actually following their standard protocol around people on respirators and having kind of respiratory challenges. And I believe they're transferred if they're on a respirator for more than 24 hours. And so we may not, again, get the COVID test results back within that time frame, but that's the main criteria they're using if they would have transferred an individual anyways.
Would it not make, I mean, this is a little simplistic, but that's how my brain works. If I start not feeling well, let's say I've got an oximeter, it starts dropping close to 90. I say to my wife, I mean, and I get tested, and so I've got COVID, things are starting to head south. I say, get me out of here. Drive me to Denver, get me to a teaching hospital where I can get my hands on remdesivir and this other steroid in case, you know, things are going to get worse. Right? The best case scenario is you don't get worse, you've wasted some money and you go, okay, thank you. Or you do get worse and you're in the right spot from the beginning. Any thoughts on that?
You know, I think that your physician would listen to you, you know, if that's your preference, you know. but it would be made on a medical decision of whether or not, you know, you're in shape to be driven to Denver as well.
Right, of course.
Okay, we're going to move on. Jeannie?
I just had a question. All the data is about Pitkin County residents. Do we have any data on our visitors or tourists? That's either for Charlie or.
Okay. Josh, you want to take that?
Sure. Yeah. So we investigate, you know, whenever we receive a report of someone who tests positive that lives out of the county, we investigate it, but we don't really track it too much. And there's 2 reasons for it. One is because we don't want to accidentally double count and make sure we don't want to count it here and have them count it somewhere else. And then 2, we don't hear about a lot of the cases that, you know, may have association or affiliation with Pitkin County. And so we feel like, you know, if we're counting some of them, but not all of them, it would really just be misleading. So we just don't count any that are out of state or out of county.
Got it. Okay. Anne has a question.
In terms of the vaccine, as the virus mutated from D216 to G216, I think those were the names. is any work that was done pre-May on vaccines, is that throwaway now? Each time it mutates, do you have to come up with a different vaccine? Or start developing, researching a different vaccine? I guess that would be for Charlie or Josh.
Go ahead, Josh.
Yeah, I mean, I wish I had a better answer. And I think from everything I've understood about it, no. And it's because the changes are very small. They seem significant, but they're not that significant. They may make it more infectious, but it wouldn't necessarily mean that the vaccine wouldn't be useful or effective. And so from what I'm understanding, what they're looking at right now is that, if they do get a vaccine, because they know it mutates so often, they're thinking that there's a possibility it may not be a long-lasting vaccine. Obviously, that's all up in the air. It's all speculation, and no one really knows for sure. But there are a lot of researchers out there thinking, this may be something similar to a flu vaccine, where you're going to get it more often than just once.
Okay, thanks.
Yeah,
Thanks, Hank.
I would just add to that real quickly that, that the vaccines are made from various components of the virus, so some may be focused on the spike protein, some may be focused on other elements of it. So, those vaccines that are not looking at the spike virus that changed, may not be affected anyway.
Okay, I think we should keep moving. Karen, are we ready to move on?
Sure. Lindsay, can you bring up the slideshow again, please?
And it looks like we're a little bit behind here, so I'll rush you.
So I think we decided, Greg, we would go ahead and skip this, I think, for now. So
Got it. We'll pick this up at the next opportunity.
that
But
leads us.
everyone send us in your pictures with your mask so we can keep building on our modeling campaign. Thank you, Tom and Jeannie and Tori and whoever else has contributed.
And Tracy's on the line, Greg, so I thought she could just talk about some of the messaging that they have in the hopper.
Great, Tracy. Yeah, take it away.
Maybe.
Are you there, Tracy?
Oh, sorry, I am.
She's there. Well, yeah,
I
there
was
you are.
busy
Great.
typing something else. Yeah, and then I was like, that's my slide. Hi, gang. Thanks for having me today. So really, first of all, just wanted to thank Board of Health for really getting this campaign moving. Greg, I know you were a big driver behind it, but I think it's a fantastic grassroots effort to get people, really paying attention and recognizing that this is a community-driven. And we know visitors have a piece of that, and they may not know who everyone is, but it still sends a pretty strong message. So we're really
Kudos
looking
to
at
Tom.
how we take this, and it's becoming a pretty viral type of campaign, but how we go further with it. And if that means, again, we're trying to get it into advertising and print. And I just think we really want to see this one have legs for a while, and also kind of keep this very focused message, right? On, I wear a mask, the 5 commitments, the 3 C's. There's a ton of information people are able to access around COVID everywhere. And I really want us to be sure we're staying true to the public health message in particular for Pitkin County.
I wanted to give a shout out to Tom Kurt, who inspired and kind of gave me the kick in the butt to push for this. So he deserves credit for his vision on making a public campaign like this.
And I'll say thank you too to Lindsay Douglas, who's obviously helping with the Board of Health, because she's really helping us organize it and keep track of everything coming in, because we really have had a lot of good outreach coming back to us. So fantastic first step with this campaign. I think
Great.
I'm probably.
That's it.
I missed what the question was before I came on, which is where we're at with kind of our campaign. I know there was a question about what's happening at the airport. So I wanted to share again, if many of you haven't been out to that airport, which I've heard a few times from others, is you can't get through to baggage claim until you've gone by this table that has a tremendous amount of literature and information, and definitely our 5 commitments. there's the fantastic video you've seen that's running on the Jumbotron. And then there's sandwich boards everywhere that, again, are driving people to think about, what it is that we're holding most dear in Pitkin County in order to stay open. So I think
yeah, there was some dialogue. Maybe they'll have a chance to speak about it later. I know Tori's on. Marky's not with us today, but Marky had some firsthand experience at the airport, and she reported seeing a pretty high uptake of mask use. She thought it was pretty impressive that we had arriving people with their masks on, and that was encouraging. Of course, others have said the opposite, so it depends on when you're coming in.
Greg?
A question from Ann.
Yeah, no, just a comment. Thanks, Tracy. Last time I was out there, there was a much bigger sign on the table that was really effective. It was a big kind of blue and green sign. And also there was I don't see it in that. There was a big basket of masks that people could just grab on their way through. And again, I went out just to see, and I was pretty impressed at the arrival with the information that was out there. So thanks.
And it's interesting you mentioned that big sign, because that was really the first, back in March, sign that we did out there, I think, around social distancing, and was on sandwich boards throughout town. I'm guessing maybe it just got moved, or one of the sandwich boards has put the 5 commitments on it since then. But and I bet you the masks were there too. I just probably didn't capture it in this image, but I know that they were actually packaging masks with a sticker that had the 5 commitments on it as well. So it's really hard for you to miss what the message is.
Right, I grabbed one. So I got one for my own. No, and this was just within the last 2 weeks. So maybe they changed something around.
Bill, did you have a question? I wasn't sure if that was a hand wave or he's not saying anything, he's just waving at us. Okay. All right, thank you. Let's keep going.
Well, yeah, you're all pretty familiar with this, so nothing new here. One thing I will share, and I think it was a question that came up from Board of Health, was the conversation around the drive market. We know that we have a lot of people coming through, very funneled through the airport in a way where they can't miss the information, but what about those people driving into town? And I know that Phyllis and Scott and the team at the county has worked to get some additional VMS boards. I can tell you from my past life that we know VMSs have a pretty good impact on people driving by. I know the city of Aspen's had one out for a while at the roundabout that's really effective. I know down in Basalt, they have them right there by the city market. And so there's a lot of VMS out there. I will go back to sharing that I believe that our outreach through our tourism partners is still going to be the best way to kind of reach those visitors. I mean, again, because that drive market is, you don't know where they're specifically going. They're really everywhere right now. And so we're just continuing to grow that partnership with ACRA and Go Snowmass and with the Basalt Chamber to be sure the public health message is what still is being included in their information around people here and in the community.
And Tracy, VMS is variable message sign, is that correct? Like the amber signs we see on the side of the road?
It is. And we've reached out to CDOT too. They have pretty specific rules about what they put on those big boards, but I know that they'll work with us if there's something new. In the early stages of the incident, we had them, putting things like only essential travel when we were more in that suppressed state. But they also will work with us, but they have some pretty specific messages they already have out about wearing masks as well.
Great.
One last question, Greg.
Sure, Ann, go ahead.
What about the general aviation? What kind of setup? I wasn't able to get in there. What kind of setup is out there?
That's a great question, Ann, because I haven't been over there either. I don't know if I've ever been over to the general aviation side. So let me.
It's not very user friendly if you're not.
Maybe I couldn't get in anyway, right? But that's a good point. Let me do some outreach and find out, because that's an important piece.
Because I think that's a large part of the visitors that we're trying to get into compliance. So
yeah. And unless there's somebody else from the county that has been on that side of it, I will follow. I'll make that an action item to follow up, though. That's a great question.
Great, thanks.
Hey, and this is Kara. I think we actually have some further details further down in this presentation, because I know that was one of the questions that came up.
Oh, okay.
And so the airport has given us, I think that it's almost 2 full slides. So when we get there, we'll circle back on that question.
Thanks.
I had a question from Brent here also before we move on.
Just a quick one, given what Tracy's saying, obviously this is super important, and obviously urgency is part of the message. And I want to support the use of cell phones. I think when your cell phone goes off, it creates, we all answer it, there's a certain urgency involved. And I think to the extent that we have cell phone messages reaching out, and I wouldn't care if it was once a day, but you know, whatever, once a week. But the point is, it has inherently in it a sense of urgency, and it means we're serious, and it means we're using all arms of the government to reach out. And I think that's a very good way to kind of strengthen, you know, our message about mask compliance and social distancing and so forth.
Thanks, Brent. I know Kelly brought that up as well in our meeting yesterday. She really appreciates it. I think our board does as well. The tricky part is to make sure we don't do it too often. It's like the boy you cried wolf. If you get too many Pitkin alerts, you start turning them off. So
well, you know,
super
Fauci
careful.
even said if there's ever a time to overreact and be obsessive, now's the time. So,
yeah, I hear you.
One of the challenges with the alerts is that you basically have to opt in, right? And so one of the things that Pat Bingham did a great job with Brett Loeb is there's rack cards in about 200 locations around town with Pitkin alert information for visitors to actually opt in. So we use this at X Games. Again, the challenges will be, you know, I think there's a place we're going to do some more outreaches with concierge at hotels, making sure that those rack cards are really available to, you know, invite visitors to do that, and recognizing that once they opt in, it can just be for the time they're here. So we really are trying to maximize our use of the Pitkin alert system. So thank you for those comments.
Okay, Karen, where to now? Or Tracy, are you moving? You have more for us? I have some other things related I could bring up, but I thought I'd save those for the round robin.
Lindsay, I don't think I have too many more slides after this. Nope. So I'll stay on for round robin.
Thanks, Tracy.
Great. Thanks, Greg. Yeah, I wanted to take a little bit of time to just talk about some of the adjustments we're making in the public health order, which we're still in our amendment that lasts until tomorrow. There are a couple places where the state went ahead and opened up libraries to a certain extent, and feel like that is still a very low risk business. And so we went ahead and aligned our message with the state message on a difference in how the libraries can operate. We added some clarifying language that when we say 6 feet distancing in a restaurant, it's from patrons, not from tables. So just a little bit of a clarification for restaurants on that. And that performers, if it's in a theater event, that they would maintain 25 feet its distance from patrons. And we're also tightening up our language around isolation and quarantine, as Josh and Charlie have alluded to. We have been seeing a little bit of a reluctance or resistance to participating really in the disease investigation process. And it is really critical that we have, you know, if the public health department calls, please answer your phone. Don't hang up on them when they call you. We're really actually trying to protect your health and your neighbors and friends and family's health, and really trying to contain the disease in the community. And so your participation as a community member is really critical. And so we're just tightening up a little bit of the language on isolation and quarantine to ensure that people understand that that is part of the, that we have ability to kind of have compliance around that if needed. So those are some, I would say, a little bit minor changes. We would like to go ahead and extend our current public health order for 30 days. The state has extended their safer at home order as of July 1st for 30 days. That allows us again to wait to see what the state does and then to be able to have a little bit of time to react to it. So we want to give ourselves a little bit more time out of that 30 days from the state. What, as I said in the beginning of this meeting, as we have this trigger document that we'll be sharing with you, if there's need to think about tightening things up, we'll go ahead and pull together an emergency Board of Health meeting. But until then, we don't anticipate that we want to change anything beside these pieces right now in the public health order. We don't want to, increase group sizes or event sizes or anything like that right now, given the data that we're seeing. We also don't want to make any drastic knee-jerk reactions to tightening up something really quickly. So we want to see, once we have that trigger document, we can share with you our thinking on that. But if we need to next week, we will call together the board and talk through things we might need to tighten up, because we don't want to get to a space where we don't have any ability to address this beside the public health order, right? We want all of those other containment strategies to be effective so that we don't have to do some more drastic mitigation.
Hey, Karen,
Yeah.
do you need a vote from our board, or would it help you to have a thumbs up from our board if you're re-upping this public health order? I know it's your purview, but would it help to have us contribute to the backing this up?
Yeah, I think from the board, if we concur that we're gonna stay, in essence, stay the course beside those minor changes we're making, and that we will come together if we need to tighten down. That would be helpful. That's philosophically
Okay.
where we want to go.
If someone could make a motion to that extent, we could get a second, then we could further discuss it. Tom? You're muted. Wait a second, you're still muted. There you go.
I move that we extend the public health orders for 30 days and follow the guidelines of Karen Slide as shown.
Thank you. Do I have a second? I see a second from Brent. Is that right? Okay. Further discussion. Does anybody want to? Tori?
Thank you very much. Good afternoon, everybody. Thank you for this discussion. And Karen, thanks for the update here. Mine is just, I guess, a little ask for help. In that public health order clarifications, what I see with the restaurants is about the clarification of 6 feet separation between patrons. This seems to have gone around the wheel maybe once. I think, 8 feet between this was talked about, 6 feet between that was talked about. So this clarification is great, but this is very difficult. And so I'd almost be asking for a little bit of the county's help in what can we do, how should we do it in order to get compliance here. What I'm saying is, when you talk about, and of course, I'm advocating for the health and safety of operations. So, but when you talk about separating tables by 6 feet between people, you talk about 8 to 10 feet between tables, you talk about really a capacity conundrum there for restaurants that don't have the space. So as the city of Aspen has expanded into the right-of-way for some of our restaurants, giving them some more outdoor space in order to accommodate what we've seen, this clarification is definitely a difficult one to match for the businesses. So I guess I'm just kind of asking for a little bit of help from the county and maybe suggestions about what we can do here in the city, and a little bit of guidance to come from not just changing the public health order, but how do we implement that and how do we get compliance. So it's more of an ask just for county participation and help with how we're going to make this safe and successful is just what I wanted to bring to the table.
Thanks, Tori. Other comment from the board on this? I think you've made some really good points there. I think simplification, clarification is always good. And because it's a moving target, it's always changing. And I know that frustrates a lot of people. Other comment, or Karen, do you have you want to weigh in here?
Yeah, thanks, Tori. And it is partly it's to align with the state public health order and the way that they've defined it. But Kara, I know that you've been talking with the business sector, and I'm just wondering if you want to weigh in on the implications, or Jordana, of what that could mean and how we could help support them in that.
This is Jordana Sabella with Pickens County Public Health, and I can share, Tori, that, as Karen said, this is to align with the state. All of our guidance thus far has aligned with the state in saying that we need 6 feet between patrons. So this is just so that we are clear. And then going forward, the city of Aspen's burgeoning compliance department has really started to do some great work with restaurants on this exact issue. So I don't think Jeanette is on here right now, but from what I understand, they've been working with restaurants on this issue and what makes most sense for them, whether they have fixed tables or tables that, you know, if you have to sit 3 people here and then it's, you know, how are you measuring between patrons? They're doing some great work with making markings on the sidewalk so that it's understandable both to the folks that are working at the establishment as well as the compliance folks when they come by to check to ensure that the distancing requirements are being met. So I don't have the exact understanding of what their system is that they're working through, but know that they're really working in partnership with those restaurants to be able to figure out what's a way that we all first understand what the guidelines are, understand why they're important, and then understand what's a system that we can develop together to make it so that we can all abide by those.
Okay, well, I appreciate your participation and your input on that, and just keeping that that county's eye with the city, just working together is going to be invaluable here. So any way that you can support the city folks that are out there doing that is great. And last comment real quickly before we move forward on communications, I just want to say that really, starting last week, I thought that we really took steps forward. The yard signs that have been placed throughout Aspen have been great. The light pole banner signs that have gone up, the mask initiative for the photos from the county, the Board of Health. Really, we've stepped up the game here in the last couple of weeks, and it's been great. Moving forward, I just hope that we can continue to work together there. So I'm just wanting to make sure that the city and the county are, saying the same thing and messaging the same messages. So I don't know what avenue that is these days between Tracy and somebody at the city, but I just want to make sure that put a plug in for making sure that our messaging stays on even some of the same language, because we're often saying the same thing but in different ways, and that can even be confusing. So anyway, just wanted to put that in there that want to keep working together as city and county resources.
And
Thanks,
Tori.
Tori.
Really
super
quickly.
important.
Sorry, Greg.
Yeah, go ahead.
We have started a coordination call every other week with kind of a bigger, broader group of communications folks. And I think that's really helping all of us be in that same space as well. So I appreciate that.
Great. Thank you.
Thanks, Tracy.
Thank you for your work.
Yeah, and Tori, that has come up with our board as well. In fact, the commissioners asked if the Board of Health would like to see the county, have our restaurant rules sync up with the cities regarding a curfew. That was brought up as one of the questions. Social distancing, as we said, come up. I think we've covered that now, and the whys of social distancing in the restaurants, why 6 feet, is so important. Just so people are using hopefully an acquired knowledge of why they're doing it, rather than just following a rule that seems to change, even if it's incrementally. And I know that's a tough ask to get people to really understand why we're doing this. But I want to thank you all for your work on that. But I'd love to see our board, this Board of Health, encourage my other board, the Board of County Commissioners, to follow suit. They're kind of waiting for an invitation to join up and sync up. And I think that certainly could include the city's program as well. So I'm going to tell them we got a thumbs up there for those of you who held your thumbs up just now.
Yeah.
Okay, Karen, where are we now? Should we go to round robin, or you have more for us?
Karen, you're muted.
Yeah. Still muted. There you go.
Lindsay, if you can just bring up the slideshow really quickly. Thank you. Great. Okay. And if you can, yeah. So really, we tried to compile. Well, we did compile all of the questions that we were getting through the Google form as well as through email. Hopefully, we captured them all. Forgive us if we missed something this time around. But we did want to somehow with the round robin, we wanted to make sure that you heard that we addressed or tried to address some of your questions coming in. So Greg, I don't know if you want to do this first or you want to do round robin. This might answer some of the round robin questions. So,
you know what I'd love to do first is just circle back very quickly to our public health order. I had suggested we had a motion and a second and some discussion, but I never called it. I apologize. So I want to call the vote on that updating the public health order, running it for another 30 days with the changes that Karen articulated. Could I see a show of hands for that? It looks like we've got my Board of Health are all, do we have an, okay, it looks like everybody's on. So I think I'm gonna say that's unanimous. We have a consensus that we're going to follow through with the reinstatement of the public health order as it stands with Karen's changes. Now we're gonna need to articulate that for media and for outreach, and Karen, I'm gonna count on you for that. Was there another thing we needed to vote on? If I might just check real quickly, I wanna see if there's anything else. We've got the thumbs up regarding that we think Pitkin County should impose the same curfew on restaurants. And that's, Redstone, places outlying in the county. Okay, and then I'll be ready for round robin. I think we've done that bit of work there.
the only last thing, Greg, was the testing strategy potential for the Board of Health to sign on to a letter regarding a statewide testing strategy.
Yes, and I think you may have shared that with us. Do you want to share the text that you sent some bullet points? I could try to bring them up unless you can, just to articulate what the other counties are saying and what we're signing on to.
Sure. Yeah. I don't honestly have the bullet points in front of me, but I'll try to do it from memory. What we're really asking for is Eagle County is submitting a letter. If we have the city and the BOCC and the Board of Health all come together and submit this letter, and we're really asking the state to give us their testing, statewide testing strategy, that they have something in place and that they're really thinking through some of the potential barriers that we're already starting to face on a local level, and that they are able to articulate and implement that strategy across the state. So it's an advocacy letter to hopefully help us locally. And just, we didn't really talk about it in the data presentation, but for all of you to be aware that we, when the testing increased, so the state lab used to be able to do 160 tests a day. Now they've been able, their capacity is up to 3,000, which is pretty significant, but they already have reached their capacity and have started to farm out some of their testing to private labs. We know that because of the increase of COVID-19 through the country and increased need for testing, that testing supplies are starting to be in short order as well across the nation. And I would just say, I'll just be honest, that's probably a failure at the federal level. And then we're also seeing these longer turnaround times, the TATs. And in essence, the longer the turnaround time, the more someone doesn't know that they might have COVID-19 illness. And it also really hinders our box-it-in strategy and being able to get people into isolation and quarantine right away. And so it just is a critical piece to that whole box-it-in to have good testing strategy. And so we're asking the state to really create that.
This is a ubiquitous statewide testing strategy. I've got your letter here. I just sent it to Lindsay and asked her to forward that to the board. The one thing I might add is that item number 4 says testing will not eliminate the need for social distancing as part of that letter. Do we need to include masks in that social distancing comment? I don't want to change it and have to go to get it wordsmithed at Eagle County again, but I would add masks to that sentence is what popped into my mind, if that makes sense
now
to
that
you.
Eagle County has a mask order as well, or a mask requirement as well, that makes sense. Yeah.
I might just add that to it if you're responding to them. So everyone should have that in their email fairly soon here. And I think we'd probably like to contribute to that letter as soon as possible. And if anybody needs me, thumbs up from Tori. Has everyone seen this? I want to make sure we've all seen it. Or I think Jeannie says she's seen it. Yeah, okay. Linda's seen it. Tom's seen it. Okay, I think we've got enough here that we can say, let's pull the trigger on that. Do we need a vote or do we just need the thumbs up? Karen, you could tell me.
Yeah, you could vote on it. I think that'd be great.
Okay, all in favor. Give me the thumbs up again on joining in this letter. Okay, I see it. Thank you. Great.
Sorry, Greg,
Thank
we
you for
just need a
that.
motion and a second before the vote.
Oh, we do. Okay. We need, so I need somebody to move that we sign on to this letter from Eagle County. Need a motion in a second.
A motion.
I get 'em.
Hang on.
Okay, got a move from Brent.
Yeah.
I'll second it.
Second from Jeannie, I think that was Jeannie. All in favor? One more time. Thank you. I'll hand thumbs up. Thank you all. Okay, that's it. I think we're unanimous, Lindsay. Thanks for keeping us on track with that. All right. Anything else, Karen? As we get into questions?
Yeah, Greg, so do you want us to go through the answers to the questions we have so far, or do you want to get more feedback from the board before we do that?
We have 40 minutes until we're supposed to adjourn. I just want to make sure we've got time to get through it. We've always felt rushed for time. So maybe if you've got I don't know how long the list is. So maybe a succinct list that may answer some of the questions some of us have. So why don't you go ahead and with an eye on the clock and we'll try to keep some time open.
Great.
For additional.
Okay, perfect. Lindsay, if you can bring the slides up with the questions and answers, that'd be great. And team, I'm gonna rely on you a little bit because I think that maybe the answer is on another page, or you're just going to answer this verbally.
Yeah, the answer's on the next page. Do you want me to?
Okay.
Happy to take these. So thank you, Board of Health members, for submitting your questions. And I will go through this pretty quick, Greg, and then if we want to go back and cover things in more detail, I can do that as well. So the question was around case investigations and contact tracing. So typically right now we're getting our test results from one of two ways. One is through our electronic data system, which is at the top, kind of the middle top part of this graphic. In Colorado, it's called CDRS, the Colorado Electronic Disease Reporting System. Because there's been some delays in us getting that information, our EPI team has also created an online form and sent out a HAN, which is a health action or health alert network communication to all of our providers, asking them to fill out a form if they receive test results, so we can initiate our contact tracing faster than we were able to previously. So then it goes to this next area on the right, top right. So then our EPI team, one of our leads will then triage that for assignment, meaning that it's assigned to one of our contact tracing staff members. We do have a new staff, Sam, who started with us this week that we're really excited about. And we have a few more people joining next week as well. So Sam would be one of the leads who might be assigning a case to another staff member, who then calls the patient and conducts what's called a case interview, and really confirming that they understand their test results, what needs to happen in regards to isolating after their symptoms have started, or from the time their symptoms have started, referring them to any kind of medical provider if there are severe symptoms. So again, the patient should be getting a call first from their medical provider with the test results, but as public health, when we do the contact tracing, we just want to make sure they know that. And if they are experiencing any severe medical, kind of any emergency medical attention needs, like trouble breathing or bluish lips or face, inability to stay awake, things like that, really reminding them to call 911 at that point. Our team also collaborates very strongly with our Human Services Department, which provides support around economic assistance, food deliveries, medication deliveries, as well as housing if people are unable to isolate at home or do not have stable housing. And then ongoingly, you'll see kind of here on the left box, our contact tracing team follows up with people. This is a CDC document which says daily. Our team was doing daily check-ins with folks previously. We've transitioned a little bit to allowing them to call us if they need to, but we're also checking in with them, I believe, every the first day, the third day, and 7th day or 14th day if they're in quarantine. Again, to check if they need more food, medication, referral to a doctor, or anything like that. So then the next slide takes it from the case investigation to the contact tracing. So you noticed earlier that there was the piece where during the interview with the first individual, we asked them about their contacts, and we have a similar process with the interviews from there on. So after we learn about an individual's contacts, if one person has 4 or 5 different contacts, each of those contacts are assigned to a staff member to conduct the interview, find out a little bit more information from them about any needs they may have around, again, groceries, medications, housing, things of that nature, if they've developed symptoms or not. If they have developed symptoms, encouraging them to get tested. And it would kind of follow this curve to the left here around quarantining or transitioning to isolation if they've developed symptoms from there. And as Josh mentioned earlier, when we're doing the case investigation and the contact tracing, we also confirm through CEDARS and the interview their county of residence. So if they're an individual who maybe got tested in Pitkin because they work here, but they live in Garfield or Eagle, then we would transition that case to Garfield or Eagle County Public Health. If they're a traveler outside of the region, we also have a strong relationship with the state epidemiology team and can refer cases to them for any out-of-state travelers, including international visitors. Then the next question we received was around, Lindsay, oh, thanks, was related to our contact tracing. So really around our procedures, capacity, things of that nature. So currently with our team that we have right now, we have the capacity to contact trace an average of 5 to 6 cases per day. And that does fluctuate a little bit based on the number of contacts they have. And it's really a rolling number. If we get 12 one day, but 0 the next day, we might be able to manage that. If we're consistently getting more than 5 or 6, it does become a little bit challenging right now. And at that point, we have a system where we can reach out to CDPHE's epidemiology team that's divided up by different regions of the state, and we work with their team 3. As we have new staff members joining over the next couple of weeks, we do anticipate that capacity growing quite a bit. In regards to our capability, we're really happy to share that we've continued to be able to initiate our contact or case investigations within 6 hours for 100% of our cases still. The state guidelines is within 24 hours. So we've really been able to keep up with a much higher quality of the box it in strategy at this point. The limitation, as you all know, has been around our staff capacity, but again, that's something that's changing day by day at this point. So within the next couple of weeks, you'll see we have another contact tracing lead starting next week, and then we have 4 more contact tracers starting over the next couple of weeks as well. And 3 of those individuals are bilingual in English and Spanish, so that also grows our capacity to be able to better serve our Spanish-speaking community members. Greg, I'm not sure if you want me to just run through these really quick. I know we're tight on time.
I prefer to let's do the abbreviated, and if somebody needs to flag us to slow down or back up, we will, but I'd say let's keep flying here. Why don't you?
Okay, sounds good.
Thank you.
So then the next question, I think we have 3 more questions. So I'll try and go through these pretty quickly. I think Tracy addressed a lot of this, so I won't go into every line here on this slide, but the question was around guests arriving by car. So as Tracy mentioned, we do have those signs along the highway, and we have strong partnerships with our tourism partners. So if any of them are here on the Board of Health listening in, thank you again for all of your support in getting those communications out to our visitors. We also do have our testing available to all community members, locals, as well as travelers. So that's been an opportunity for us to continue reiterating our 5 commitments to everyone here. Next question was around our contact tracing or our cases per week. Karen, I'll have you address this one if you don't mind.
Yeah. Sorry, I changed everyone's slide after the fact, so they didn't know I did this. So we, as you know, we've been tracking our own criteria for a roadmap to reopening and our trigger map to reclosing, and our data is really pretty complex in what we're looking at. We're looking at a pretty robust data set. I know that what the community, when we got our variance, the one number that was really associated with the variance was the 18 cases. I would say that number isn't really very relevant anymore, because when we got our variance, the state was actually in a tighter scenario with the Safer at Home Public Health Order 2028. As our variance came into place, the state continued to loosen up things within the Public Health Order 2028. And right now, we're actually more than likely on either we're aligned with the state or we're more strict than the state. There is not much that we have, and I can't actually think of anything right now that's more loose than the state. And the things that are more loose than the state would be the things that the variance would then, if the variance was taken away, those are the things that would be going away. So I don't know if the 18 number is really as important of a number as it was when we got our variance. What I think that we really want to, well, I know what we really want to exemplify is the data that we're collecting as a community. This more robust data set of really tells us more truly where we are as a community, and to use that data to figure out if we should tighten up. And of course, now with the Protect Our Neighbor, that's the process for loosening up, is to actually move into the Protect Our Neighbor next phase. So, and I'll let the IPI, if anyone else wants to speak to this, but I think we got, that number was important for a while, but it's not as relevant anymore.
Okay, next question. I think that's a no from Charlie, so we'll keep going. Thanks.
Thanks, Darren. All right, and then the last question we had was around the airport. So just understanding what kind of regulations are happening there to keep people safe. So right now, the report that we got from the airport is the FAA does not provide guidance or requirements on screening passengers at this time. I think it's a conversation that's continuing to happen, and they're anticipating some requirements being passed shortly, but they haven't released anything. That being said, our airport has completed over 150 action items, and they've really gone above and beyond what we're hearing other industry committees are discussing and things like that. So we really commend the airport for all of the actions they've been taking. I won't read through everything, but Lindsay, if you can flip to the next slide, there's a section around, and we'll link these slides to the minutes that we'll share out with everyone so you can refer back to them. But these are some of the steps, we're not listing all 150, but a few of the steps that the airport has already taken to improve their procedures and align with COVID response guidelines and best practices. And then the next slide, which I know there's a question previously around the GA or FB, the fixed base operators and general aviation, as well as the airlines and what actions they're taking. So this also provides a little bit more information around the steps that the different elements of the airport are taking to keep everyone safer. That's it. Those are all the questions that we had submitted on the form. So thank you for any of you who fill that out for us. And Greg, we can either open it up to questions related to these responses or other questions for the round robin.
Okay, I think we've got basically half an hour. I wouldn't mind going a little over if we had to, but we've got half an hour now. Let's see how far we get. I've got several questions I can forward from my fellow BOCC members and myself, but I'd like to give others a chance to weigh in before I take up all the time here. So call out if I'm not sure I can see you, if you have a question or a comment, and I'd like to include everybody on this, but let's give preference to our board members. Any other questions, comments, anything coming? I'm not seeing a lot of hands leaping up here. I'm just going to keep scanning here and look for okay, Linda, go ahead.
I was hiking this weekend, and I noticed that on the trails, which are so narrow, there were so many people that did not have a mask. And I think I started out maybe suggesting somebody wear a mask, and then kind of gave up because there were so many people. I couldn't spin up my oxygen level on admonishing everybody, and also people get so defensive. And I think that a lot of them are visitors, but I don't know how to address that other than what we are doing, and wondered if there are any suggestions for that, because this was on the way up to Cathedral Lake, and I'm certain it's probably everywhere. So suggestions would be appreciated.
Can we tally that question? I'd like to go to Brent. I don't know if you want to answer that one or if you've got another one.
Oh, no, I try not to answer any questions, but I, I second what Linda said, and I've seen this all over so many places, and it's disturbing. And my quick take is that, we're, not to be pedantic, but, we're in a fight with an unknown enemy of unknown strength. And either we're at war or we're not. I would argue we're at war. And when you're at war and you can't identify the enemy, much less his strength, you need to really throw everything at it you can, right? And if we're at that point, and Karen said we're at a critical point, and Charlie alluded to that kind of thing, and I'm saying that the compliance, we know even more now that we realize this thing is aerosol, and that changes the game out many more feet, that somehow we need to strengthen the protocol, the idea of not only social distancing, but wearing a mask above all. And many countries and many communities now, as we've seen in the United States, are making this mandatory. And I'm a little afraid this is one thing we do not want to get behind. And in fact, we start out behind. We're always reactionary to this thing because of just the nature of a pandemic. And somehow we need to, either through cell phone, text messaging, through better signage, through people taking greater responsibility, somehow we need to enforce that message, because if we don't do that, then this game is going to be very much uglier in the future than it is now, and game over. So anyway, that's
Thank you, Brent. Okay, I'm going to chime in, folks. Happily, you can just blurt in if we're in the way. I would like, if I could, to add on to that, questions coming from my board and certainly from the community have been, what can we do next regarding encouraging people, whether it's incentivizing or enforcing. We've had some, I'd have to say, disappointing news only that about our law enforcement doesn't seem to really want to get behind getting heavy-handed regarding writing tickets or finding people. I'm not sure they know what they would what to do yet. And I think what I'm hearing from my fellow commissioners is, would the Board of Health advocate that the commission pass an ordinance? If we need to be more assertive regarding an ordinance. I'd ask Karen that. I want to make sure we're in line here. But if the Board of Health felt that way, that we needed to be more assertive, then encouragement for the BOCC and the City Council might be a good thing, because we haven't convinced our local law enforcement that it's their job to participate in this yet. And I want to hear more about it. We want to invite them to a conversation about it before we do anything drastic. But I think it's time to have that conversation. Karen, can you add to that?
Sure. Yeah. Thanks, Craig. And I know I did send out a point of clarification, but I'm just going to say this for the viewing public as well. So we've had a mask ordinance in the public health order since actually May 9th. And that is enforceable by law enforcement. It's actually enforceable by the Board of Health as well as myself through other methods. And so just to be clear that there is ability to enforce on the mask order within the public health order, and that actually covers all of Pitkin County. So it covers town of Snowmass and Basalt and Emma. And so I think just to be clear that we have that, it doesn't mean that the BOCC couldn't take an additional action. We just want to make sure that we're not, I don't know if we're, if that helps with just amplification of the message or if it's duplication, I'm not entirely sure. I would say one place that we could all do, one thing we could all do is when we write the advocacy letter to the state around testing, if we feel like it would behoove the state of Colorado to have a statewide mask ordinance, because right now it's unique to employees and businesses. It's not, you know, for the there's guidance for the general public, but it's not a requirement. I think that there's some leverage there to ask at the state level that we would want to see that across the state, because you know, I feel like Governor Polis has been a really strong advocate for mask wearing, but it hasn't kind of made it into that next phase of law. And if we're worried about visitors coming into our community and not understanding that, it's much harder to express, well, in Pitkin County, this is what we expect. But if it's not ubiquitous across the state, it makes the messaging really confusing for folks, especially if they're traveling around the state. So I think that's a place for advocacy, honestly, from the Board of Health.
Okay, so I
can say wear a mask, it's the law, right? Wear a mask, it's the law. It's not just polite, it's not just smart, it's the law. But anyway.
Thank you, Brent. I think Karen has reminded us that we already have an ordinance, thank you. And that really what was been suggested then is it's time to have a meeting of the minds and get the sheriff and the police chief in here so we can have a discussion with them at the BOCC level and or the Board of Health level. That's one option that I think we should advocate for personally, and what I've heard, what I think I'm hearing. And then secondly, that we would want to advocate to the governor as a Board of Health that they implement a mandatory mask order. Is that correct? Is that what, like, that's what I heard Karen just say? Other options may come up. I see Tom has his hand up. Oh, you're still muted.
I think police are enforcing matters of life and death. And I think COVID-19 is a matter of life and death. So I think the orders should be enforced by the police and the sheriff in a friendly but firm manner.
Thank you, Tom. Tracy, if you're still on, that's our quotable quote. I appreciate that. And other thoughts on this? We've got two possible actions on the table. Hands up. Was that Billy? Did you have a hand up? No. Okay. Just wanted. Charlie.
I was just going to add that we have both carrot and stick options, and I think those enforcement options are important, and we should run them down. On the carrot side, you know, I mean, giving something to law enforcement like a "I Love Aspen" mask or something like that they could hand out that people would maybe want to have. And I would leave that in the hands of Tracy and the communications people to come up with a design that makes it attractive, but give law enforcement something they can actually hand out as they educate people. And if they still get pushback, then it would go over to the enforcement side.
That's a terrific idea, I think. That's great.
I agree.
Thank you. I think we've got an agreement. I sent out a note. I don't know if you've all seen it by now, but I did propose that we look at the cards, the yellow cards that Alaska Airlines and I think others are handing out, where they explain why it's so important for our economy, our public health, and what are the consequences if you're not going to you know, we've already, if you're not going to comply. In an op-ed in the paper, our chair of our Board of County Commissioners has already invited people not to come to Aspen, Colorado, or to Pitkin County if they just don't see themselves being able to comply with these public health concerns and mask orders, to come another time when the threat is passed. And I think that we could be more assertive. I would advocate for a handout card like this. Maybe the police could give a mask and an explanation card. But I do like the idea of the carrot and the stick, and I think it's time to speak about both. I don't want to rush into. I think maybe we should have an invitation to have a lengthier conversation with law enforcement before we issue some sort of order. But I think we could all vote, or we could have a consensus and a show of hands on whether we think we should move forward with these recommendations. Certainly with the letter to the governor, that to me would be a slam dunk to just do that now. And then I think an invitation for law enforcement to join us at the next meeting is an easy one as well. So I'm going to ask for a motion.
Can I make a comment really quickly, Greg? Sorry.
Please do, Ann. Yeah.
Sorry.
I can't see you. Sorry. Sorry if
Oh,
you were waiting.
sorry.
I can't see on my screen.
Okay. Yeah, two things. 4th of July, I joined the police at their booth on the mall, and we were handing out masks. They weren't the most exciting graphically, but people were really receptive to it, and they stopped by and we talked to them and explained what was going on. So yeah, I think if we can get them to continue to do that and do something with like the Aspen City logo or something. Well, one of the things somebody came up with was, let's do a T-shirt that says dress like a local, wear a mask. So something like that. Secondly, I was going to ask Karen, and I guess Greg may have just explained it. What's the next step in advocating for a state mask face covering law? Is that just a letter to the editor, or do we need to go out and get a couple other counties to join us, or what?
Yeah, it's actually been a conversation we've been having with our CalFA, our local public health directors meeting. And I think even with probably all of our own worries about our community and mask wearing, we actually have a community that's pretty receptive to wearing masks. And I think I just want to say thank you actually to the community around this. Mask compliance has to be in a certain percentage to be effective. And so we really just need to get to that efficacy level, knowing that there are some folks that can't wear masks for medical reasons and little ones. And so there's always a percentage that probably is going to not have the ability to wear masks. But if we can get to that efficacy percentage in this community, I think that will be really amazing. And I do think we have a lot of people that are genuinely interested and want to do the right thing. So I'm just putting that out there because there are many communities that I think are really struggling with masks. And without having a statewide order, they don't have the political will to be able to pass those kinds of ordinances or put that in their public health order. And so I think just collectively, if we want to support our neighboring counties and neighboring local public health directors, if we all believe that masks are really critical to containment of the disease in Colorado, having a statewide blanket order will really help those communities to be able to then have more carrot and stick around the mask. So when I think about how to advocate at the state, the Board of Health could certainly have its own kind of letter, but we could also create a letter through CalFA where different boards of health sign on. And that's another methodology where, again, and I think to your point, the more counties, the more cities that sign on, the more powerful it's going to be. And we can, if this board is willing to do that, I can do the back end of that to get those, to work on the bigger picture on that.
Before this gets away from us, can I just get a motion to that we do that we implement on this activity, and a second, and then we can vote on it, and at least you'll have direction to move forward if that will help you.
So moved.
I'll second.
Okay, Linda seconded. Tom made the first. Linda the second. All in favor? Show me your hands.
Clarity on what was moved. What was the motion?
Okay, clarity is that Karen, you might need to articulate this for me, but it's that we are going to advocate to the governor for a statewide mask mandate. Is there any other detail we need to add to that?
I think the idea that we would, through the statewide organizations, go out to other counties, in addition to our letter, try to coordinate other counties with a second letter, a second appeal.
Right. And that we would advocate to the other public health directors in the state as well as to the governor.
Thank you for that. Let me just, if this is discussion on this, just to let you guys, CAST, Colorado Association of Ski Towns, is sending a letter of that nature to the governor.
Oh, good.
Excellent. Excellent. Okay, Brent, more discussion on this before we vote?
Well, I'm totally in favor, but just to beat the drum again, getting back to Charlie, this whole thing, this mask wearing around here, having the police gently but positively enforce this, having masks and so forth, I think that turns it into a positive. It makes the police into a benign protector versus, a law enforcer. It serves the function of communicating that we really care about our people, and we're willing to go out and we can do it immediately almost. Anything else is gonna take a little while. And the quicker we do any of this, the better. So
yeah.
I love your comment about the police really are guardians rather than enforcers. And I think we've looked at our police that way, and that fits the job description perfectly. I think we're going to be inviting our law enforcement to join us at our next Board of Health meeting. If we can get it on this next agenda, it would make sense. And we will report back to the BOCC, or I will, that we're advocating for this. I don't know if I need a vote on that, but I'll take one if somebody wants to move. Well, let me finish this last one. Did we vote on the first one? I want to make sure we got the vote. All in favor in that last motion. I think I see an aye. Great. Thank you all. Okay. Lindsay, I hope you're keeping track of this. Sorry if I get confused there. Okay, so, okay. And then we're voting to invite the law enforcement to participate and join us in this conversation on next steps on you know, how do we become more effective in enforcing an ordinance that we have already established and has been in place now for months.
Well, that's 2 weeks away though, isn't it?
Well, if we had to call a special meeting, we could. So I don't want to, I don't think I'll do that one right now. I think I'd rather circle back and let staff advise. But I'd love to have the direction from Board of Health. I think that would help the county, the BOCC, as well as the community. I'll look for a motion if somebody has one.
Well, I'd like to make a motion that the Board of Health reach out to the police and strongly suggest or discuss anyway some sort of diplomatic mask enforcement, and then ideally having some masks and something else, so it's sort of as a transaction there. And I'm not quite sure how to put that in kind of legalese, but I'll leave that to Greg. Smart, you do that. Put it together.
Oh, thanks. Okay, we've got a motion. I think what he's saying is we are really what we're doing is we're going to invite law enforcement to participate with us in a conversation about how we can implement on the ordinance that we've already passed in ways that we can ensure the public health as they do and enforce the rules that we've made.
Yeah, it's actually just a nuance. We're not changing much. It's just a nuance.
Right.
Yeah.
Karen?
Yeah, I was just going to say, I know that I'm meeting with Sheriff DeSalvo on Friday to talk through a little bit more, and I think that there's more staff coordination with law enforcement. So I'm wondering, we'll do some back end work for the Board of Health, and then we can have a representative attend the next board meeting to give an update if that would work.
I think that sounds good.
Okay.
That sounds good. I think I need a second on that. If I didn't see when Brent made a motion, we'll take that motion. Tom's got a second. All in favor, hands up. Okay. Thank you. I think I see everyone. Okay, has passed. We have a question from Tori, and then it was that somebody else chimed in. I didn't see you. Jordana.
Jordana's been trying to get a word in, so I'm going to let her go quick.
Okay, go ahead. Sorry, I couldn't see it.
Thanks, Tori. I just want to make sure that we're all on the same page here as we're talking about masks. I see a little bit of definition setting is really helpful in this conversation and anytime that we move forward with this conversation. So the public health mask current language around face covering is that they're required to be worn in all buildings, whether they're public or private, that are open to the public. So that's something that's, I think, is being enforced pretty well right now, and that players are there. And then just to clarify, when folks are talking about being outside or being on trails, the current language is that if you're outside, masks are required if there's a risk of being within 6 feet of another person who's not of the same household for more than 10 minutes. So when we talk about passing people on trails and walking around town, that's not, that's a different kind of enforcement than I think what some folks are talking about and referring to. So that's our current language in the order.
Great. Thanks, Jordana. Thank you. I really appreciate you saying that. If I could, I'm going to see a note here from our county attorney to my associate Kelly, who was asking us a question about how do we go about enforcing. And here's what John Ely said. John, you may be on the call, but I'm going to just reiterate what you said. He said, from a legal perspective, he'd rather the Board of County Commissioners discuss options rather than the Board of Health. Only because the commissioners have more of an understanding in a process. It would rather be best if the Board of Health simply pass along the simpler recommendation that enforcement be increased and allow the BOCC, the City Council, Town of Snowmass arrive at the appropriate action. So that's the advice from our attorney, which I think is pretty good advice. I don't know if we need to amend our suggestion just now. I don't think we do, but I think that seems to be a path forward. That way we're not boxing ourselves in, because that gives the attorney and the commissioners and the City Council, Town of Snowmass, the leeway to exercise this as they may need it. Does that make sense? Do I need to repeat that? Or I think what we're advocating is that we make the recommendation that enforcement be increased and allow the county commissioners, City Council, Town of Snowmass Village to implement as necessary. Are we still on track with that? I need a show of hands before we need to rephrase our motion, or can we amend it and move forward? And I'm looking for hands up, or we're making sausage here. Sorry guys, but we're.
So
yes, please. Okay, so in the City of Aspen's work, we've done a lot of that. We've consulted with our APD. Our city manager has a lot of insight in that as well. We've struggled with this enforcement piece has been a struggle. I was actually going to pick up I was going to say the same thing as Jordana actually pointed out for us, is that currently in the health order that we have here, we've been very careful, both the city and the county and the Board of Health. We've really tried to design this mask mandate with those allowances for people not to be wearing a mask at certain times. So that's one of the things that maybe we want to consider, is about strengthening actually the language that's in the mask mandate, whether it's about that eliminating the 10-minute clause that's in there, whether it's about carrying a mask, having a mask with you at all times. What we've seen in other areas, both here in Colorado, mountain towns, as well as around the country, is that there are whole mask wearing zones, right? So it's possible that Pitkin County is a mask wearing zone, and we get away from some of the allowances that we've done. Now, I'm not putting that forth right now as a motion, because I think what's most important here is to talk with our law enforcement, is to talk with our county, city managers, as well as attorneys, to figure out an overall strategy for this, not just a one-shot strategies. But as you all know, the city of Aspen has, along with ACRA in our downtown core, has stepped up giving out masks. We have ambassadors that are on the streets that are talking with people directly. Our police officers are involved, but again, they have not had that direction to be ticket writing, maybe as we're starting to move that way in this conversation. But I just wanted to bring up that, on one hand, our mask mandate here has a lot of allowance to it, and maybe that's something that we don't want. But I do very much support the conversation going forward with legal, law enforcement, and our management to figure out how this is best done and executed. Thanks.
Thanks, Tori. If I could, then I think we should clarify the motion that was put out, mainly just to take it back to the language that our attorneys have provided, that we make the recommendation that enforcement be increased and allow the BOCC, City Council, TOSV arrive at the appropriate action. I want to interject just from my own personal experience. If I see somebody wearing a mask as they're riding their bike solo up a hill and there's nobody within half a mile of them, it doesn't make sense to wear your mask then. If you need to breathe, it might be better to take the mask off. So we do need to inject a certain amount of, I hate to use the word common sense, but that has to be part of it. So my inclination right now is to go back and get, Karen's going to be meeting with law enforcement on Friday. Maybe we should just leave it at that. And the motion would be that we're urging, as he said, we're recommending that enforcement be increased and just leave it at that. Okay, in which case I'm going to call for an amendment to that motion, and then we can call the question, move on. That means I need someone to, thanks, Brent.
Okay, I'll amend my previous amendment, if that's what it was, whatever it was.
Okay.
But I will say that the Board of Health would like to recommend to the Board of Commissioners that they potentially strengthen enforcement of mask wearing or something like that.
Okay. Tori, do you want to say something?
Well, just to include not just the BOCC, but it was top of Snowmass Village in the city of Aspen. It's a motion that recommends from the Board of Health that enforcement of the mask mandates would be helpful. Yeah. And I would second that.
Okay, we have a second. I'm going to call it right now. All in favor? Thank you all. Okay, I think Tori, you froze, but I'm going to, since you've seconded, I'm going to assume you're voting for it. Your picture froze. All right. I have a couple other quick points. We're at 3:30 right now. Can we go another 10 minutes? Would that be a problem? If anybody needs to drop out, if we can go another 10. I just want to make sure we've covered everything and give other people an opportunity. I know that we've been told by the state that we are one of 2 counties being selected for contact tracing technology. I'm not sure what that means, but I'd like to hear what we know about it. Karen, could you tell us about that?
Yeah, Kurt's the one that's been on this project, but I'm wondering, Suzuho or Josh, if you can talk a little bit to the contact tracing app process or technology that we've been involved with the state.
Sure. So there's 2 of us from Pitkin County who are going to be testing these different systems. I've already done 2 of them. We have another staff member who is also going to be testing 2 of them as well. And basically it's a 45-minute session led by the state. We kind of walk through a sandbox of the new system that's been created. And as we're walking through the system, we discuss any sort of challenges that we're having with it or any sort of different aspects that we would like to be included in the system. So we've been doing that. I think the state's plan is to compile all that data by the end of this week and to really make a recommendation by the end of next week, from what I was told.
Josh, can you just do a brief overview of what the app is what it's gonna actually do?
Sure. So it essentially be a database or a system that every local health department could use around the state. And we would put all of our confirmed COVID-19 cases in there. We'd also put all of our exposed contacts in there. And other individuals from around the state would be able to have access to that information. So really it's a big database where we can all talk and we can discuss cases and really use as a placeholder for all of our information rather than having to use several different systems, which is what we're doing right now. Every county has their own system. So it's really trying to bring everyone together onto the same system so that, it's easier for us to conduct these investigations, pull data, et cetera.
Right. Thanks, Josh. Thanks for that. The last thing I have just from Steve Child, our fellow commissioner and our chair of the board of county commissioners was a question, is there anything we can do to incentivize people to participate in contact tracing, to participate in incentives, as Charlie mentioned earlier, the carrot and the stick, suggestions for that. I think a great looking mask is one great thing. An Aspen mask that you'd want to have and take back with you. This would be a great thing. Any other incentives we can come up with so that really it's a friendly gesture from the community to visitors than something on the way of enforcement. And maybe we just need to think about that and come up with options. I wanted to also share with you that with this mask campaign that we got started rolling, I was contacted by a local organization that would love to do a fashion show, maybe around the 1st of August, a mask fashion show, and inspire people to come up with creative new masks. I think we're ready to evolve to mask version 2.0 from 1.0 with some really innovative ways you can have a mask that's functional and maybe more stylish, more comfortable, easier to wear as a daily accessory. So get ready for the fashion show. And also, while I'm at it, I'm going to give a plug. If you haven't sent me a photo wearing a mask yet, please do, to pio@pitkincounty.com or to me, and we'll get your photos. And it's very helpful to have our full demographic represented in modeling mask behavior. Is there anything else we have here, Karen? Can you see anything else we need to speak about? Any other questions, burning questions from the board before we all take off? I don't see any hands up. I'm going to go and check Jordana's screen and the other screen. I don't see anybody else here. So I'm going to, do we actually have to make a motion to adjourn this meeting, or do we just end it? Who'd like to stop?
I'll move to adjourn the meeting.
Okay, Jeannie's got, and we have a second from Tom. Any discussion? I don't see any discussion here. Thank you all in favor. Okay, aye. I'd say we have a consensus. Thank you for joining the Board of Health today, and we'll all be in touch soon. Appreciate your.
Thanks, Greg.
Thank you.
Thanks, Greg.
Take care. We'll see Marky next time.